Hi, it's me, Sandy Nickel, and I'm recording this video this evening to discuss some alternatives to medications, prescription drugs for certain health conditions, ones that I am afflicted with, that being diabetes type 2, high blood pressure, high cholesterol, macular degeneration, now just in my right eye, and also gallstones. So, if you had watched my video that I did earlier today titled Sandy's Medical Care, actually Sandy's Medical Fund, I'm sorry, a little tired, but anyway, so I am going to tell you about some products that I have found, and I've done some research about it and discovered that there is an alternative to help me when somebody cannot afford medical prescription drugs. Like in our case, we can't afford them, the prescriptions anymore. All that's in my video, Sandy's Medical Fund, if you care to go watch that one. Awesome. If not, let's move forward. Now, these products I have found online at the most reasonable, affordable prices. I've done a lot of look-in and comparison shopping, and so far Swanson's Vitamins is the most affordable. Okay, they're the cheapest I've found so far. Okay, and again, that's swansonsvitamins.com. Okay, so the first product here I'm going to talk about, though it doesn't really help with any particular condition, it's help with your digestive, which does tie in with your gallstones a little bit to some degree, because it's all together and it's for digestion. Okay, for better digestion. This particular product is called FemFlora. It has approximately 10 billion viable organisms per capsule, and you have the option of taking 1 or 2 per day. I'm going to be actually switching to a different one. It's got 90 billion viable organisms, I think, per capsule. I'm not really sure, I can't remember, but it's, I think, also for women, available through Swanson's Vitamins. This one's also for women. They have options for men too, or if you don't really care, well, either way they have, just, it's good for anybody. Now, you might be thinking, well, if you need probiotics, why not eat a bunch of I thought the same thing too, until I found out in my research that because yogurt is pasteurized, that process actually kills the majority, if not all, of the healthful bacteria you're trying to get into your body. So the only way you're going to get live organisms into your body is through supplements. Do your own research, don't take my word for it, look into it. But here's a good product. I've been taking these products now for 3 weeks, and some of these products I took before when I was first diagnosed with diabetes, such as the chromium picolinate. No, that's not it. Chromium picolinate. Now, it's best if you can get all vitamins and minerals as chelated, but if it's a bit out of your price range, or you haven't found a formula that you like particularly, just about any chromium picolinate will do just fine. This helps with metabolizing your blood sugars and your insulin levels, making them more effective. Now, a lot of professionals, they think that 200 mcg is sufficient. Not if you're diabetic. No. If you're already healthy, yes, it can help you just with 200 mcg per day. A diabetic needs a minimum, and I've done the research. A diabetic type 2 needs 800 mcg per day. What you do, but you don't take it at once. You don't take that 800 all at once. You take it over the course of the day, with each meal, and probably at bedtime's a good time. with a little bit of a small snack, maybe a slice of cheese, celery stick, something like that, something light, because you're going to bed. But this is 200 mcg per tablet. I take one tablet 4 times a day, and it does work for controlling. I mean, really controlling your diabetes. But you've got to be doing all the right stuff along with it. You can't just take this and go out and eat half, or you know, a Big Mac with a large fry and shake. No, 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 no. It's not going to work. You have to have a healthy diet. You have to consume the proper amount of water. And people think 64 ounces a day is sufficient water. No, it's not. It goes by your body weight. Let's say you weigh 200 pounds. You need half your body weight in pounds, but in ounces actually, of water daily. Okay, so if you're 200 pounds, you need 100 ounces of water per day to properly hydrate and just for your health. Okay, to be properly hydrated. So that's the chromium picolinate. And this next product here is multiglandular for women. They have a men's formula, then they have just that's good for well, they don't say unisex, but it'll just say multiglandular. And this is also available through Swanson. Forgive me for kind of being a little weird with the reading, but I got messed up eye over here. I mean, macular degeneration in the right eye, so I kind of got to read things at a weird angle. But so the multiglandular, it helps all your glands to properly function. I chose the women's formula because I felt it would benefit me most than taking that's good. And you take this one once a day, and I take it at bedtime. That's my choice, but you can take it whenever you want. And then the next one for gallstones, it's called Stone Free. Now everything except for one product is all of it's through Swanson's Vitamins. There's only one product here that's actually from GNC. But back to the Stone Free, it actually helps with preventing and aiding with existing gallstones, liver stones, and kidney stones. I really don't know how it works, but I've had a testimonial from a fairly reliable source, because she has a friend that had tried this or something similar to it, a similar formula, and she had kidney stones, and I don't know how long she was on the product, but she ended up not having to have her kidney removed. It actually cleared up and went away, and she was able to pass the stones. So this product here will help you pass the stones. Somehow the formula works to soften and to some extent break down into smaller pieces the stones so that your body can pass them naturally. Okay, now with this product you must drink a lot of water. You must drink your quota, otherwise you will become dehydrated and you'll have a hard time going number 2. Oh, and there's something else I wanted to say. I can't remember what it was now, but anyway, next product. This is a formula. Excuse me. Because I am over 50 years of age, I chose this Alive product. Multivitamin, multi-mineral, women 50 plus. Okay, it's really good. I've actually been a little bit more energetic these last few weeks. I've been on these products, so I'm feeling a difference. Also, back to the gallbladder pains that I've been having, really bad pain. Sometimes I can't even get out of bed. It's so bad. I can barely walk. But since I've been on the product, the gallstone thing, the Stone Free, I am still in pain, but it's not as often. But you also got to watch your diet. Stay away from fatty foods. So I've had a major life change as that in regards to diet as well. Also about gallstones and kidney stones, and I don't know about liver stones, but kidney stones and gallstones. Another thing that helps with them is by drinking lemon water. And I think it's like 3 or 4 tablespoons for every 8 ounces of water. You can do more. What I've been doing, I just make lemonade from concentrated lemon juice, and I've been using artificial sweeteners, but I'm going to switch that to probably agave, blue agave, organic blue agave. It's a natural, all natural sweetener, but it's not artificial. Which artificial sweeteners, as you know, they're not too good for the body. They're not good at all. I found out through my research that artificial sweeteners, they go into your body. Your body does not know what to do with this artificial. Your body doesn't know what to do with those artificial chemicals, artificial things. And guess what it does? I don't know what to do with this. I'm going to store it as fat. So there you go. So drinking lemon juice is good. Also, apple cider vinegar and some apple juice is good. I believe it's also 4 tablespoons to quarter cup, or quarter cups. It equals the same thing. Quarter cup of apple cider vinegar into apple juice. Make sure it's all natural, preferably not from concentrate. At room temperature if you can stand it. Also, the lemon water's at room temperature too. Both of those things, along with the stone-free, does help with your kidney pains, your gallbladder pains, and eventually start softening things up so you can pass them however your body naturally passes those kind of things. I'm not a doctor. Again, don't take my word for any of this. Please do your own research. Ask your doctors about anything that you think you might want to take. I asked mine about taking these things because I told her what was coming up, and she looked at me like she thought I was kind of but she said, you can take any vitamins, minerals, or any kind of nutritional supplement you want. Anything you want to try, it's not going to hurt you. So, and also I talked to my eye doctor about what I'm going to talk about next, and that is for eye conditions, your overall eye health. And I cannot pronounce the name of this thing, but excuse me for a moment. I'm going to give it my best shot. Astaxanthin and zeaxanthin. And this particular bottle, also from Swanson, it's got 4 milligrams of each substance. And I think you take it once a day. One soft gel per day with water. Okay. You can take these anytime you want. I'm gonna hold this up to you, and hopefully you can see. Okay, there. Maybe not. Okay, let's try the light off. There we go. Can you see that? Sort of. Okay, I'm sorry. Well, anyway, I guess that wasn't going to work too good. So I'm going to spell this for you if you want. ASTAXANTI. I'm sorry. ASTAXANTI. I did it again. AS. AN, thin, just like the word thin. Astaxanthin, and ZEAX, as in X-ray. ANTI. Thin. Zeaxanthin. Anyway, there you go. The other thing that I'm going to be adding to this regime for my macular degeneration is lutein, 20 milligrams per day. And they do have, Swanson does have a formula with all three nutrients in them, but it's way more expensive that way. Well, not super more expensive, but you save a few dollars by actually buying this bottle along with the lutein, 20 milligram lutein bottle. You actually end up saving, instead of spending about $24 a month, you actually, if you buy it on their easy refill plan, you set it up so that you get, I think, 2 bottles of this, and they actually, quite often they will, don't buy this thing through the easy refill. You just add it to whatever order you're ordering as a one-time order, and you can actually get 2 of these for like 20 bucks, and that'll last you. Each bottle will last you 2 months. So you got a 4-month supply into the 2 bottles for $20, and then you buy the lutein. I think it's once every 40. I can't remember how I set it up. Anyway, you do the math. You can figure out how often you need to get these things. But it comes out to 14 bucks a month, as to opposed to buying the 1 bottle for like $24 a month, because you only get like 30 tablets in that other bottle where you get all 3. So you actually save some money by doing it 2 separately. So you got to take an extra pill. Big wow. You save money over in the long run. The other thing I'm going to be adding to help with my blood pressure and cholesterol is a product I discovered called, well, I've heard of it before, but I never really studied or looked into it until recently. And that's CoQ10. You heard of CoQ10, right? Okay. If you're a normal healthy person, you could probably go with the standard dosage, which I really don't know what the standard is. But if you've already got high blood pressure and high cholesterol and you need to make sure it's under control, well, obviously stay away from the fatty fried stuff, eat healthy foods, drink lots of water. Okay, that's a given. Everybody knows that you got to do those things, and sleep right. Dehydrate yourself quickly. But when it comes to the CoQ10, just like in diabetes, you actually need more of the nutrient than a normal healthy person can get away with 200 mcg of the chromium picolinate, whereas somebody already with type 2 diabetes, you need 800 mcg per day, like I told you earlier. With the CoQ10, I'm ordering the 200 is it milligram? I think it's milligram, but I'm getting the 200 milligram. My husband and I both are going to be taking it. So, because you need more to take care of an issue that's already there. It's just the way it works out. I've done research, and it came to that conclusion that 200 is really what you need when you already have the problem in your body. CoQ10 is also good for the other stuff. It's good for high blood pressure. It's good for high cholesterol. It's good for your heart. It's overall it's a very good thing for overall health in your body. Okay, is what my research has. I haven't been able to talk to anybody who's been taking CoQ10, but I've heard about a lot of good things through testimonials, but nobody I've known personally or through a friend or family member. But it's something I'm going to do. Another thing that you can do that's really good for your body is garlic. Now, you can either, if you love the taste of garlic or love the taste of garlic, go garlic nuts. Buy yourself a 2-pound bag of garlic and just add it to everything. Take those things and slice them up. Garlic presses, they're messy. And you don't, I don't know, I didn't like it. I tried it once and it was just, I found it really messy. So I just slice it up into thin little slivers, and I add it to whatever I'm cooking, or I throw it in salads. But sometimes that just isn't enough, because sometimes you just don't want that garlic taste in your food. So I'm also going to be, I've ordered garlic tablets, and it's I can't remember if it's odorless or not, but for garlic you need a minimum of 1,000 units to 1,500, okay? When you already have health conditions, you need the extra garlic. It's not going to hurt you. It's just garlic, okay? So you may or may not have garlicky breath. Just eat some peppermint, or some parsley. Parsley can counteract the negative smell that comes from your body from eating garlic in a natural way. Or chew peppermint leaves, spearmint leaves, Altoids. That's really good when you have a little breath going on. And garlic is good for your immune system. It's a natural antibiotic. It's also, I believe, don't quote me on this, but I believe it's also a cancer-fighting agent. And the last thing I'm going to talk about is calcium. This is for you ladies out there, again, for the ladies. Contrary to belief, you do not need, you need more than what they say you need, what is it, 200 milligrams, 500 milligrams, I don't know. Us older women, we need, I think it's 1,200. 1,200 milligrams? Yeah. 1,200 milligrams of calcium per day when you hit 50. And 75, I think it goes up to 1,600, but don't quote me on that. I might be a little wrong. It's been a couple of weeks since I did the research, but this is actually from GNC. It's actually a bottle I've had for a while, because I bought quite a bit of it. I got it on a good sale, so I bought several bottles of this thing, and this is the last one. So I don't know if I'm going to stick to it. It's exactly what I need, because you take 3 per day, and it delivers 1,000 milligrams daily of calcium. Plus, along with what I get here, I am getting calcium. I am getting the required minimum 1,200 milligrams between these two products. Okay. Also, along with the GNC brand, I have the D3, which helps in your absorption. What you get in your multivitamin, multi-minerals, you need that extra magnesium and vitamin D3. Some people even think you need extra vitamin B. I really don't know about that. I'm not a doctor. I'm just going with what has worked for me in the past and what's helping me now. So do your own research. Do talk to your doctors. Most doctors I've ever talked to, in fact every doctor I've talked to except my current doctor, they've always shied away from nutritional supplements. They don't want to recommend them as alternative medication for your conditions. They always want to stick you with the medications. But what if you can't afford the medications anymore? Or what if you're a person like me who's just very sensitive to drugs in general? Even caffeine. I'm just sensitive to chemicals and drugs. I react sometimes in a very allergic reaction. Well, not like allergic where I can't breathe. But I do have reactions a lot of the times from drugs. And right now we can't afford the prescription drugs, so even though nutritional supplements and vitamins and all that, they are expensive. I'm not gonna lie. I'm not gonna blow smoke up your yahoo. Oh, I shouldn't say that word. Yoo-hoo. Anyway, you know what I mean. They do cost. They do cost a lot. But when compared to having to shell out $800 or $1,000 just for your monthly insulin supply, insurance doesn't cover it. An average of $150 a month for your new meds, vitamins and supplements, herbal stuff, saves you a lot of money, and it gives you the same results. Now, I want to just kind of backpedal a little bit about the chromium carbonate. You're not going to see results immediately. It's one of those type of things where it has to build up in your system a little bit to start seeing results. When I was first diagnosed with diabetes back in '95, I went on this because I didn't have any medical insurance at the time. I could not afford the $200 a month of, at the time it was $200 a month for my particular insulin that was recommended. So I said, no way, I'm going to look for it. My aunt actually take for that. She's always been into nutritional healing, and I've learned from her and from my own studying too. And now I got books on the on nutritional healing. Nutritional healing for prescription for nutritional healing. I think is the right name of it. But anyway, it's a book about that thick. Big heavy book. Tip: go to halfebay.com, or I think it's half.com, something like that. Google it. You'll get the right site. Great place to find books for cheap. If there's a book you want and you know it's going to be $30 to $50, check halfebay.com and look for it there. I mean, I picked a book, I kid you not, for like under $5. A lot of books. So sometimes I'm like the more popular ones, nutritional healing, prescription for nutritional healing. That one you could probably find it online for anywhere from $7 to $15. That doesn't include the roughly $4 shipping. They call it, I think they call it media shipping, media something. Anyway, so if you want to learn and study for yourself about nutritional healing, healing through nutritional supplements and so on, check out some books online. Before you buy them, go to your local bookstore, a big one, you know, big box bookstore like Barnes and Nobles, if you have one. Go there and actually go there, pick up the book from the shelf and look at it. If you like it, then you go back to halfbay.com and purchase it. That's my little trick, and it's worked for me for years. You may have to wait a little bit to find the book that you want on eBay for when you're ready to actually purchase it. You know, by the time you come back, you know, by the time you go to Barnes and Noble and check out the book, it might be gone, or the price that you want might be gone. Just keep checking it. You know, every other day you'll finally get the book. You know, I save quite a bit of money shopping for books that way. Sorry, Barnes and Noble. Not all of us can afford those full retail prices. When you're living paycheck to paycheck, you don't want to go out and spend $50 on a book. Okay, sorry. I would definitely prefer new to used, simply because it's new. It doesn't have anybody smudge or whatever. Anywho, if there is any questions you have regarding nutritional supplements for whatever condition you might have, give me a note, give me a comment, and ask, you know, what do we think about this, what I think about that, and I'll be happy to spend a little bit of time to do some research and tell you where to look. And I like anything, I'm not a doctor. I cannot give a medical advice. I cannot give a medical advice. I can just tell you what I have myself used, currently use, will use, and information that I have found myself on my research. I'm only sharing information that I have found on research, okay? But always, even though I do research thorough, as far as thorough, for me, was thorough. If it's thorough for you and somebody else, could be different. do your own research on everything I recommend here, and find out other products and compare, find formulas that resonate with you as far as what your body personally buys, and do ask your doctor. I can't stress that enough, even though your doctor will probably say, like former doctors have told me, they just don't want to say anything really about nutritional supplements whatsoever, good or bad. So where does that leave us, the people who may not can afford the prescription drugs? So I hope this has been informational and helpful to you. If you did find it informational, maybe not particularly useful to you, but at least informational, educational, please like my channel, and share the videos. Watch all my videos, please. Okay. So thank you for watching. I know this is probably a little bit longer than what you may have thought it might be, but I thank you for watching to the end, and you have a great and pleasant day, and I hope you have a blessed life. Bye.